Hello and welcome back to Healing the Gap. Today we have one of our pilot awardees, Dr. Brittany Myers, to talk about her project. Dr. Myers, can you introduce yourself?
Yeah, thank you so much for having me. My name is Dr. Brittany Myers. I'm a pediatric psychologist here at Metro Health. I can talk a little bit about my role, and then we can talk more about the research, later on. But I am a pediatric psychologist specifically within our integrated primary care team. So what that means is that when kids come in for their pediatric visits to see their pediatricians for well child visits or sick visits, or even some of the specialists, we have a psychology team embedded there so that we can do consultation in the moment. So if you bring your kid to the pediatrician and you've got a concern about depression or anxiety or separation or toileting, those are things that you can meet with a psychologist with right then and there and talk about as a part of your pediatric visit and have a consultation. So that's kind of what I do, but I specialize in work with our Hispanic clinic. We have a bilingual pediatric clinic, our Hispanic clinic, and I am a bilingual pediatric psychologist. So I specialize in working within that community and both in English and in Spanish. And so that's kind of my specialty area.
Great, thank you. And next, we would love to have you just give an overview of your project or your study that you've been working on with the pilot awardees.
Yeah, well, so it kind of stems from that work that I'm doing in integrated care within our pediatric Hispanic clinic. I have noticed over several years of practice that a lot of times I'll be seeing patients specifically, I specialize in working with adolescents and with depression and anxiety. And I was noticing that within our Hispanic clinic, that when I was working with our teenagers who are depressed, that a lot of times that our families had been through a lot together, that a lot of times what the kids were dealing with were an offshoot of what the parents were dealing with, that the families had been through trauma, that the families had stressors going on, and that the parents also really needed a lot of support and had unmet mental health needs, and they were easily able to access mental health services for their children, namely me in the role that I was in our primary care clinic, but really that the parents were having a hard time accessing services for themselves and had barriers to getting particularly bilingual services within the community for their own mental health, that they were often having needs themselves that weren't being met. And so the project stems from that. And so what I wanted to look at was when we're treating teens for depression within this primary care environment, one, just what measuring what is going on for the parents. Do the parents of teenagers suffering from depression have their own unmet mental health needs, and getting a better measurement of that and what those are within this particular patient population? And and then on top of that, if we give them a list of referrals, how likely are they to connect versus if we work directly with a community partner and make it easier and reduce barriers for those families to connect to their own services as their teens are getting their support, the mental health support. So that's really what I was looking at is, do parents of depressed teens have their own unmet mental health needs, particularly within our Hispanic clinic? And two, does getting them directly connected with our community partner improve their symptoms and the teen's symptoms more than if we just give them a list of referrals and say, here's some places you can call? And so that's really what I was looking at with my study.
That's a really, I think, important topic. I really find it fascinating because I've worked on a project at CHEER where we studied sleep apnea
Mhm.
within African American patients, but we involved their bed partner. And so involving a family member's health as well within like the primary patient's health is a concept that I think is really interested, that like integrated model of like, especially within minority communities, health is communal and very family oriented and not like a siloed individual experience. So I think I really like that avenue that you've taken with your project. One of the questions Josh and I had was, what are some of the common mental health stressors within the Hispanic community in Cleveland?
Yeah, I think in Cleveland here, one of the stressors that I see most commonly, so we have families who are, families who have been here for a long time, families who are more, newly arrived, and we've got patients coming from a number of different backgrounds, but we do have a pretty large Puerto Rican community here in Cleveland. And I would say probably 90%, 80, 90% of our patient population within our Hispanic clinic is Puerto Rican. And so one of the kind of particular stressors that I see within that community has to do with Hurricane Maria in 2017 and a lot of the subsequent, the earthquakes that were happening in Puerto Rico and some of the other stressors and challenges happening in Puerto Rico from 2017 onward that actually created a ripple effect where we had a lot of patients newly arriving to Cleveland from 2017 onward. And so in terms of the stressors to our patient population here within the Hispanic community in Cleveland, a lot of it has to do with being newly arrived within, either last week or within the last couple of years and acclimating and acculturating to life here within Cleveland. And just, even things like differences in weather and differences in community events and what the day-to-day life looks like, disconnection from family back home in Puerto Rico, navigating life with the language barrier and getting connected to things all anew when you're, a lot of the patients that we're working with are really a displaced patient population due to natural disaster. So a lot of times you think about what would a family need and what types of supports would a family need if they just came here fresh. And that is pretty much everything. Help linking to schools, help navigating and connecting to healthcare, help navigating and connecting to school services if the kids had services prior, help finding housing, help finding employment, and just making new friends, connecting to community and churches and local organizations, learning where everything is. It's all new. And so I think that is a stressor that our patient population face, and just navigating the system, particularly with the language barrier and being able to connect to all these services within a new city and a new place and oftentimes in a different language.
You bringing up the language barrier as well. I think that was kind of connected to our next question of like, what are the barriers to mental health care for the Hispanic community within Cleveland? And I know you talked about the language barrier. I know that obviously has to be one. I know in general, there's a shortage of psychologists and therapists for a lot of underrepresented minority groups, but that probably even gets exacerbated when there's also like a language difference as well, when we need a therapist who speaks Spanish and English. And then there's the dialects on top of that. And there's a lot of cultural understanding and they all pile up on top of each other. So in addition to, I know, language, are there other barriers to mental health care for the Hispanic community?
Yeah, I think you touched on a lot of them, and it goes to every level, just from when I call this agency, will they be able to receive my call and understand what I'm asking, and will I be able to understand the instructions that I'm getting from them? Do they even have a staff member at this agency that I'm calling that can speak with me? So even if they do, that kind of first step of the question mark of will this agency be able to serve me and what will I receive on the other end of the line, I think is a barrier in and of itself. Even for agencies that have interpretation and have services, that question of what will be available for me, I think is a barrier. And then you think about, this is something I run into, you touched on the fact that there is obviously just a shortage of bilingual providers in mental health care, particularly compared to the need and the growing patient population and demographic changes within our nation, that we're just not keeping pace in terms of workforce development. But then you think about, in the medical field, that there's all sorts of different specialties, right? You've got you've got someone who specializes in endocrinology, you've got your cardiologist, you've got your neurologist. We've got specialties within mental health too. Not everyone is equally well-versed in treating different presenting concerns. And so then you slice even smaller and think about, okay, now I need to refer someone to eating disorder treatment that's also hopefully in Spanish, or at least accessible in Spanish. Now I need to help someone access OCD treatment. Now I need domestic violence treatment. Now I need treatment to help support for grief or sexual assault. and or pediatric populations or geriatric populations. So there's tons of different specialties or assessment, autism assessment, neuropsychological assessment. There's all these different subspecialties within psychology. And so you think about equal access and the workforce development that's needed to really have equal access to all of those super specialized subfields within psychology and within a given community. And it's really tough.
I kind of want to shift gears back to your
Sure.
study. And I know you mentioned in some email communications that you guys were starting to get results and do some data analysis. So I was kind of curious if you had any like preliminary things that you could share or anything that like really stood out to you or whatever you're comfortable sharing so far about the
Well,
analysis.
I'm laughing because this is as hot off the presses as it comes, because even minutes before I'm still, pounding away trying to figure out starting these analyses. But I do have some kind of broad strokes takeaways that I have at this point, and I'm still working on the nitty-gritty details. But the takeaway is that, well, one, as I suspected and kind of as initiated this study, first question is just, what are the mental health needs of the parents of depressed teens in our Hispanic clinic, and are there unmet mental health needs there? And the short answer to that was yes, very much so, and that this is a group that we could really support better and seek out and target for treatment potentially, because overall the parents of kids in this study, and remember that in this study, to qualify for this study, it was just that the kids had to screen positive for depression. So we didn't know anything about parents' mental health starting out, and there was no qualifying criteria that a parent needed to have to be able to participate, except for that their kid screened positive for depression. And yet we found that parents across the board in both of our treatment group and our family-centered treatment group and our treatment as usual group had significant depression, anxiety, significant levels of PTSD, really not that different from veteran populations in terms of the amount of PTSD symptoms that were being reported by our parents. And parenting stress. We had a parenting stress index that they completed about how they were feeling in their role as parents, their stress at managing their child's behavior or emotional concerns. And there was significant levels, about a quarter of parents had clinically significant parenting stress as well. And had their own depression scores that were on average moderate depression, but there was a subset of our parents, about 17%, that actually had severe depression, including about a quarter of our parents had some suicidal ideation. So that's just before we did any intervention, kind of just where do we stand in our first wave. And the takeaway from the intervention, at least in broad strokes, appears to be, that it did, connecting them directly to our community partner as opposed to just giving a list of referrals, did seem to make it more likely that parents would connect with services successfully at that agency than if they're just given a list of referrals. Everybody across both groups improved in their symptoms. Kids improved overall, parents improved across all the metrics generally. But in some of the areas, parents were showing slightly more improvement in their symptoms when they were connected directly to our community partner, Catholic Charities, as opposed to just being given a list of referrals. So, and overall satisfaction in participating in the study was high, and people seem to appreciate the linkage and that they were able to connect with services through the study. So I think overall it's really positive. And this is obviously just a pilot study, so it's really seeing, is there a need there, and does this model seem to work, right? And it's a smaller sample of 41 participants, but the takeaway, I think, is yes, that this is something that's promising, that this was received well by patients, and that it did seem to help them connect, and that both kids and parents seem to improve with the treatment approach of incorporating family into the treatment of the child.
That's really impressive. I think, first of all, like you said, it's a pilot. So I think the fact that it's feasible, like that's what a pilot does, is it measures if
Right.
it's like even possible to do.
Pumped about that. Right?
Yeah. And I also think it's the fact that that participants enjoyed the intervention and they had a positive experience in the research is a very like underrated just an underrated like way to like measure the success of that pilot, especially when you're dealing with marginalized communities who probably don't have like the best perceptions of research or oftentimes the best understandings of research, or shy away from like participating in clinical trials or anything that involves interventions. The fact that, you know, a group of people had a positive experience, and even the individuals who didn't seek out the services just in the intervention, the fact that knowing that they were there and having that connection
Mhm.
helped is huge. Yeah, those are really exciting results so far.
Yeah, I'm excited to see it. I mean, as I was saying, I was even typing away right before we signed on just to see if I could get some, some percentages for us, and have been excited to see that and that it was well received. And I think even just being able to do this study, within our Hispanic clinic, within primary care, which is kind of a fast-paced setting, and in just academic medicine in general, doing a study like this that's a randomized controlled trial with with a 3-month follow-up and a 6-month follow-up, and making sure that people get back on your schedule in time and that you reschedule if they no show, and trying to to track people down to see if we can get the outcomes data and things like that. It's an effort for sure, and it's particularly exciting and just rewarding, I think, to be able to do this within our Hispanic clinic, and within it, and for the health of our Hispanic community here, looking at something that's really clinically tailored, because that's another area that a lot of our interventions and a lot of the work that we do, I'm sure you've talked about in other podcasts, but a lot of the interventions that are developed around white patients. They're developed around, often higher socioeconomic status patients who are easy to reach and easy to do research on, and not really tailored to necessarily the needs of a given community. And so to be able to tailor an intervention and say, this intervention within this bilingual clinic, with families taking a family-centered approach, providing bilingual services and linking to bilingual services with a bilingual community partner, that this approach is well received and seems to work, I think is really exciting.
Very, very. I know you mentioned Catholic Charities a few times, and so I wanted to
Mhm.
spend a little bit of time just talking about the role of Catholic Charities within your project.
Yeah, shout out to Catholic Charities, my community partner. Woohoo! Catholic Charities has been wonderful, and really has been really excited to participate. When I found out about this grant, and thinking about working with a community partner and engaging a community partner, I knew about the work of Catholic Charities and that they are really involved within our immigrant and refugee communities here, and provide a lot of services, and have some bilingual services as well, as other case management services that they provide and support. I thought of them kind of naturally as someone that I'd like to work with more, but I really hadn't had a connection with them. So I actually cold called them, and this is to their credit, that there's some random provider from Metro Health is calling them up and saying, hey, I have this idea for this research grant that I'm pitching that I'd love for you all to collaborate on. And they were just all about it, and we're really excited about it, and we developed our partnership from there. So that's been very exciting for me, to develop that relationship that wasn't there before, but we've seen kind of mutually the services that they provide, that we provide here at Metro, and how we can help one another and collaborate more beyond this grant, which has been very exciting. So their role really has been, when patients were in the family-centered treatment condition of being connected to our, parents being connected directly to Catholic Charities, their role was really to provide collateral therapy to the parents, and kind of provide treatment as usual for what they would provide, what therapy would look like for them, what services their agency would normally provide, and take on those patients as any other patient from that point forward, and continue with them for the course of the study, and continue to engage those patients. And they have done just that. And a lot of the patients, to my understanding, have continued with Catholic Charities. And now on the back end, we're working to figure out, for those who will continue at Catholic Charities, or those that would like to continue services, but do they need to transfer for insurance reasons? And so now we're kind of figuring that part out, to make sure that the patients that started to receive therapy through this grant can continue to receive the services that they have been engaging in and been finding helpful.
Go Catholic Charities. Woo.
Yeah. Woo-hoo.
Yeah, I think we talk about often how, and I feel like this applies to a lot of fields of work, but particularly like hospital systems and community work. We're always like working in silos or like trying to figure out something by ourselves or set up something from scratch. And a lot of us are all trying to do the same work. So how can we like help each other do the same work? And I like the partnership that you've had with Catholic Charities within this project. I think really exemplifies like that relationship. For our next question, I know results are preliminary. We're just getting these hot off the press, but if you have any initial thoughts, ideas about what I know this is a pilot, what future dissemination and implementation could possibly look like, or like in the long run, what you want to do with these results, or what Catholic Charity wants to do with these results.
Yeah, I think, well, at the initial response, I actually am in the process of submitting to at least one national conference, the National Latinx Psych Association conference, to really disseminate, particularly within this field, and to folks who are really focused on doing bilingual work and who can maybe take this idea and this pilot and may be able to implement something similar within their own communities and practices. So I'm submitting that soon, and hopefully we'll get accepted to present there, and thinking about writing up a paper that goes a little more into detail about the intervention and about the results. But with Catholic Charities, I know we've preliminarily talked about doing a presentation at Catholic Charities locally, but they're kind of a larger organization that have sister organizations in other communities. And so thinking about how can we disseminate this work and share what we did in the collaboration that we had here with the rest of their organization, if possible.
Oh, okay. Yeah, that's a really good idea.
Yeah, so that's what the dissemination plan is as it stands. But as I said, this is hot off the presses, so we are still shaping, I think, what this will look like,
Yeah.
and steps.
Yeah, figuring out like what stories to tell, who to tell them to. Yeah. Lastly, we kind of like to end sometimes on like a reflective note, especially with our pilot awardees, because we know this is a really fun and rewarding process, a lot of learning. So curious, what were some challenges you faced, and what were some things that went well within during your time with this grant?
Yeah, I think challenges I kind of referenced, but I just think in general, doing research within our fast-paced, as a provider, providing this care within our fast-paced kind of academic medicine environment where you've got back-to-back visits and not a lot of time set aside for research, or the time that is set aside isn't necessarily always the time that coincides with when you need to be seeing research participants or patients. So I think just fitting that in and figuring out how to incorporate research within the clinical practice, and the pace of things, I think, was challenging. Um, and I think also figuring out, being that it's a bilingual project, working mostly with bilingual patients, that means all your materials obviously are in both languages. So you're kind of having to get it approved in English and then approved again in Spanish once it's finalized, and having everything kind of done in both languages. And it also meant that research personnel and who could be a part of the study and help me with the study, was a little more limited, because there are only so many bilingual providers or providers working with this patient population. So I think those are things that are challenges to the work, but that I've learned a lot from, and I feel like I now have a little roadmap of how to do this work and what the common pitfalls are. But I think what went well, one, I mean, just getting the positive feedback about the intervention and from families that it's been a positive experience, and getting to work with the families and engage more with parents. And obviously I shared this is something that I had thought about before, that I could sense that there was this unmet mental health need with our parents and that we could be doing more to support families as a whole. But this is really a more measured and structured way of doing that, and having and seeing the needs and seeing that the intervention is helpful and engaging with my community partner. I think that has all been super positive experience, and just getting positive feedback about the idea and about the intervention, I think has been very rewarding.
Great. And then our last question is, um, what advice would you give someone, yeah, essentially, what advice would you give someone who's interested in doing similar work, essentially work with a community, doing community-based research or working with a community partner?
Yeah, I think really centering the idea around what is really a need for the community that you've observed and gotten feedback from the community about. Because I think sometimes too often people will jump in and say, here's my perspective about what I think is needed, who aren't really maybe as engaged with the community or working within the community. And I think what I liked about this project is that it really came about from feedback that I've received clinically and in my own practice, and from patients, and that kind of spawned this. And I think getting to know the community that you're working in and getting feedback from them to set goals and to shape your project around that need, I think is really important. And to find support like this pilot award has been really wonderful, having as a relatively new investigator, getting that support around grant writing, around, a whole team of people to run ideas past and say, hey, how do I work this with the IRB, or how do I do this grant budget? And so that has been really super helpful as a new investigator, and I would wholeheartedly recommend it to anyone who's starting out.
Yes, I love hopping on the CBRN meetings and everyone's like troubleshooting. They're like, how do I fix this? Everyone's like, oh, try this, try this, try this. And
Um,
yeah,
Shout out to Jackie too. I have sent her so many frantic emails over the last year.
yeah. Jackie's, yeah, I can imagine. Because yeah, there's so many things. Research is, the bureaucracy is deep sometimes, and you're just like waddling through. But when you can
Yeah.
see the light and like you're like, oh, things are going right, it's good. Like it's so fun and very
Having
rewarding.
a whole team that does that and everyone who's equally enthusiastic is so just invigorating and so helpful.
Very, I 100% agree. Well, thank you so much for joining us today.
Thanks for having me.
Of course.